today we're going to talk about Lochia. Lochia is normal vaginal discharge after delivery of the newborn. It's basically just the shedding of blood and tissue after delivery. There are 3 types of Lochia: Rubra, Serosa, and Alba. I like to remember the memory trick really sore after. This helps you remember the names, but also the order of when the bleeding happens. We're going to look at the timing, color, presence of clots, and flow for each. Okay, Rubra is the first on our list. This starts right after birth and lasts for about 4 days postpartum. Lochia rubra is typically bright or dark red in color. Small clots may be present as well. The flow in the first few days is similar to a menstrual period. Okay, next is Lochia serosa. This is typically seen 4 to 10 days postpartum. The color of serosa is typically pinkish brown, and it has little to no clotting. The flow is much lighter than seen in Lochia rubra. Okay, next is Lochia alba. This is seen around 10 to 28 days postpartum, but can last up to 6 weeks postpartum. Lochia alba is typically whitish or yellowish in color. There are typically no clots present, and the flow is very small to even no blood at all. You can remember the flow of alba by thinking alba is almost gone. For more information like this, you can find it in the complete mother-baby flashcards. It has everything you need to know for your mother-baby class. The link is in the description below. Okay, some facts to know about Lochia is that the flow should be decreasing each day postpartum. Another fact is that when the woman is lying down, blood may pool in the uterus. So when she gets up, it may gush out. But note, this does not mean she is hemorrhaging. Another thing about Lochia is it tends to increase while walking and breastfeeding. Okay, let's talk about signs of an infection. Endometriitis is an infection in the lining of the uterus. Signs and symptoms of this could be a Lochia that has a foul odor, Lochia that has purulent discharge, a fever greater than 104 Fahrenheit, and abdominal tenderness. Okay, now let's talk about signs of postpartum hemorrhage relating to Lochia. Soaking a pad in less than an hour may indicate hemorrhage. Passing several and frequent clots that are larger than a nickel may also indicate hemorrhage. All right, let's review. You can remember the order of Lochia by remembering the mnemonic, really sore after. Rubra is typically seen from birth to 4 days and is bright or dark red with small clots. Serosa is typically seen 4 to 10 days postpartum and is pinkish brownish in color with little to no clotting. Alba is anywhere from 10 to 28 days postpartum, but can last up to 6 weeks. It's whitish yellowish with little to no blood and no clots. That's all for Lochia. If you found this video helpful, don't forget to subscribe to my YouTube channel. Happy studying, future nurses!